it's an easy decision. I think it really, for me, started in medical school with rotation with ovarian cancer patients, uterine cancer patients. I just thought they were the most amazing people going through a tough time, and it felt like a privilege to be able to take care of them and try and make them feel better. You actually can make a difference in people's lives. There are so many amazing advances coming out so rapidly that we can't honestly feel like we can't take a breath to catch up with it all. But we are thrilled that we can actually make a difference and help people live longer, and we're curing more patients with cancer. It's not just one area. I mean, immunotherapy is exciting. I've seen, I now have quite a few patients that are making it 5 years and beyond with stage 4 lung cancer, which we've never seen before. We didn't have that with chemo. I have a patient with kidney cancer that we went through 7 or 8 lines of therapy. He had been almost 10 years, and I thought we were in a bad situation. And then he went to our research unit, and 3 years later, he's doing fine, and he comes back and visits me, and so we start another treatment. I mean, because there's now more drugs that are approved, and he has more options. So, it's a completely different field than 15 years ago, where all we had was 1 or 2 options for, say, kidney cancer, and now he hasn't even gone through every option, and here we are almost 10 years later. So all of these new drugs coming out at lightning speed, without these research studies ongoing, we would not have that opportunity. And before, it felt like there were a lot of patients that would have to go through a trial with very little chance of working, but because we're doing more of these targeted drugs, you're getting some pretty amazing responses in early phase trials, which before you'd quote, maybe 5% chance of something working, but now I don't know the exact numbers, but it seems like it's a lot more than that. And we have lots of patients that go to the DDU and they come for some treatments, they come back, and it's nice to have that option. We all realize that we're very blessed to have this option, because if we weren't a part of FCS, and most other practices don't have this option without referring to another center, which is always an option, but it's nice to keep close to home, and you don't have to travel miles and miles to have an opportunity to get a drug that you might not be able to get without the trial. All the patients want to get better. I mean, they're interested in their health. They want to get better. They're very motivated, and it's a special group of patients.